Maternity services and midwives play a key role in supporting smoking parents to stop. And the reason for that is when parents become pregnant, that is an innate motivation to become healthier and also to give the children the best start in life. But it's important for us to be incredibly sensitive when we are posing the questions and not assuming that they don't know the harm that smoking causes on their body. It's important to listen to parents and recognise how difficult it is to quit smoking. What we will do in maternity services at the first contact with a pregnant woman or the birthing person, we do always ask them about the carbon monoxide and the smoking status. And that will be an introduction into understanding if they smoke or if they are a passive smoker, or indeed if they are surrounded in their environment by poisonous gases. At that point, we generally have a opt-out option. So every woman who discloses that they smoke and their partner or significant other will be included in that. We work really well with our stop smoking cessation services in localities where parents live and across London. And what's important is that handover between professionals, making sure there is a timely contact with parents in a way that they would like to be contacted. And it's really important to make sure that the parents are listened to. I know women would like to reduce the number of cigarettes they use as a way to support the babies, but we know the evidence shows, although that's a really positive move, but it's not sufficient. There isn't enough evidence to say that that will have the desired impact in order to improve the outcomes for the mother or the baby. So it's important to be very clear around those messages and recognising that we need to work with parents and offering them support services that are available in terms of checking in with them, seeing how things go, but also that collaborations between agencies from maternity services, smoking cessation, in-house services, but also those smoking cessation services outside in the community are key in order to come around the needs of those smoking parents to support them to kick this habit. It's very common for women who stop smoking during pregnancy would like to start after the baby's born because it's incredibly a difficult habit to kick. So therefore, that collaboration between maternity services, health visitors, smoking cessation services is incredibly key to provide that ongoing support and encouragement for women. And one way of doing that is to be very clear with the risks to the baby after the baby's born, both around passive smoking, around sudden infant death, and also around the risk of ear, chest infection and pneumonia, to help parents understand that the harm is still there and they still need to be supported and continue the effort to give up smoking. So while smoking women come through maternity services, but in order to support them to sustain giving up smoking, it's incredibly important for all partners to come together, and that will be midwives, smoking cessation advisors, health visitors, GPs, to collectively provide a wraparound service based on the need of the families to help them stop smoking. When speaking to expectant parents or a woman, a birthing person who's smoking about stop smoking, do consider the literacy level, but also any language barriers that may impact on the level of understanding. It's not sufficient enough by handing over a leaflet to parents. Do take care to go through it, explain the information to make sure they understand the implication of smoking and the impact and harm it can do on their health. And most importantly, make sure they know how to seek help.